Hi, it's Christina with the Sisyphean Journal. Today is April 14th, and I already covered today's criminal abortion anniversary, one of a string of Oklahoma City abortion deaths in and around April of 1932. Third of 8 deaths in only 2 months, attributed to two doctors, primarily Richard Thacker. You can follow the link to that woman's story below. But we've been looking a lot at Planned Parenthood lately. Let's take a look again, shall we? Now, abortion advocates like to assert that the abortion decision is between a woman and her doctor. But anybody who knows how abortion's practiced in the United States knows that there's no consult with the doctor. He's a technician. They process them like cattle. If the woman's lucky, the doctor might introduce himself, but odds are he just walks in and starts doing his thing. At Planned Parenthood of Central Pennsylvania, well, let's look at what they found in an unannounced survey conducted June 5th, 2012 at their York location. Okay. Based on a review of medical records and interviews with staff, it was determined that facility failed to ensure patients were properly identified by the operating surgeon prior to the start of a procedure for 6 of 6 medical records reviewed. They pulled 6 random medical records, and in not one of those cases did he properly identify the patient before he goes in and starts sticking instruments into her body. So if he didn't even bother to determine the identity of the patient, what are the odds that he reviewed her chart first? Pretty slim. Let's read what they found. Based on a review of medical records and interview with staff, it was determined that the facility failed to assign a physician status classification and evaluation of the patient's overall health, as it would influence the conduct and outcome of anesthesia or surgery or both, for patients who received local anesthesia in 6 of 6 medical records reviewed. Though they weren't assessing them to make sure it was safe to give them these drugs before they gave it to them. And it just wasn't clear in the records who did what when. Based on review of medical records and interview with staff, it was determined that the facility failed to ensure that each entry in each medical record was dated and authenticated by the person making the entries for 6 of 6 medical records. They didn't look like they were too diligent about their staff training either. Based on review of personnel files and interviews with staff, it was determined that the facility failed to assure infection control training or education was provided for 3 of 3 personnel files reviewed. They pulled 3 random personnel files. None of them had proper infection control training documented. And they weren't too concerned about anybody being able to call for help either, because neither the procedure room nor the patient bathrooms had emergency call bells to summon help if needed. So there it is, cream of the crop, Planned Parenthood, and that's the quality they were doing. Yeah. Trust them.